Welcome to our workplace violence number 2. This is our 201st webinar, and this is a second part to a two-part series. I'm Charles Denham. I'm chairman of TMIT Global, and I'll be the MC today. We're thrilled to have some terrific recorded sessions, and we have two great gentlemen to be reactors today as well. And this is the second part of a two-part series. And what I thought I would do is show a videotape that we think is just terrific. This was generated by the Emergency Nurses Association, for whom we have a terrific amount of respect and have been very helpful with us and real champions of care at the front line.
We need to make it publicly known what is happening to nurses. We get kicked and punched and cussed at, and we're expected to just keep a smile on our face.
Patients and their family members are so raw. They may be very angry, they may kind of lash out at you. Some days you just kind of feel like a punching bag.
Over the 10 years I've been a nurse, the environment has become more aggressive.
We've come so far that every one of our rooms here in our emergency department has a sign that states it's a crime. Assaulting or threatening behavior will not be tolerated. It's getting difficult sometimes to keep smiling.
Especially if a patient comes to you and they're yelling at you or they're upset because it took longer for me to give them pain medication than it should have. But you can't say to that patient, hey, I was just trying to save someone's life next door. Our society does not value what it takes to take care of someone. I feel like they feel entitled that a nurse is here to serve you. And I think that's maybe where the problem starts. We're here to help you.
Every time you take care of a patient, you're trying to give something from yourself. You're trying to give respect and give kindness and your knowledge, and if it just is always taking, same as with anything in life, you run out of steam. And I think a lot of the nurses are running out of steam.
Emergency nurses, their average stay in an emergency nurse as a profession is about 2 years. After about 2 years, they tend to go to seek other things.
Sometimes the change comes out of necessity. And I think more and more nurses have to find a way to have their voice heard.
I am part of the Emergency Nurses Association, and we stay up to date with national policy that involves the healthcare field.
I've been very active with Day on the Hill. When we, as the emergency nurses, go to Washington, D.C., we tackle issues that are the most pressing at the time. We have that firsthand experience to tell them these are the stories that are affecting emergency care nurses throughout the nation.
My focus has been on the challenges we face with workplace violence, both in terms of understanding the magnitude of the problem, but also determining what we can do about it. There is some legislation in D.C. around workplace violence and some mandates around what facilities need to do. And that's something that, yes, we're going to continue to advocate for legislation on that. And I think the more that we talk about it and the more that we gather data about it and really know the absolute magnitude of it, I think we will see that we accomplish greater things around eradicating workplace violence.
So we are really, really pleased to be working with the Emergency Nurses Association, and we'll have them come to speak with us. Now, last month, our webinar last month was regarding the entire area of workplace violence. And what transpired was that we understood, and as we go through the definition, we realized that that the broadened definition of the issue of workplace violence encompasses much that is not physical, much that is not just the physical typical violence that we would see and that we have been discussing. And as a result of looking at this issue, we see that the non-physical or verbal and nonverbal and threatening, intimidating, harassing, humiliating words or actions, bullying, sabotage, sexual harassment. And so many of these are just absolutely critical issues that we need to address. And they're very hard to really discuss today because we don't have the best of definitions. And so I highly recommend that you go back to last month and see the kind of where are we in the state of workplace violence. And Vicki King from MD Anderson did a terrific job of reviewing that for us, which was really spectacular. And we really recommend that you go to our website and go back to see some of that work. Now, what we've done is, and what we'll do today is forego some of the preamble discussions for those of you that are with us live, and we'll be recording for those that are on our podcast more detail. But we have two really terrific speakers with us today and reactors with us today. And so because we're really blessed to have them, what we're going to do is just move immediately to a discussion with Vicki. Vicki put what you see on the screen. She put together a terrific presentation for us. And what we did was we asked Vicki and Chief Adcox to speak with us. And what we'll first hear from is Dr. Casey Clements. So you'll hear Vicki again. We recommend that you watch her in our last video, in our last webinar. But what we'll do is we'll move to Dr. Casey Clements. Dr. Casey Clements is the not only the clinical director of the emergency department at Mayo Clinic in Rochester, where I've had the privilege to do extra training and actually was on faculty in systems engineering, health systems engineering. But Dr. Clements has been an expert in sepsis for us for many years, and he has now taken the lead on safety, occupational safety, and safety across the Mayo Clinic, and very passionate about this topic. So what we'll do first is listen to Casey Clements, Dr. Casey Clements, and then we'll have Bill Adcox and John Nance, who's a JD, as well as a patient safety leader. Bill is the Chief Security Officer and Vice President at MD Anderson, and John Nance is the best-selling author and aviation and healthcare patient safety leader. So we'll hear first from Casey Clements, and then we'll go to our two reactors.